gosh.
The future treatment for Tourette syndrome is looking better. Currently, we have the medications to help control tics, but it isn't seen as worth the amount of side effects that they have. So future medication is hoping to try to curb this, and with funding from organizations such as the Tourette's organization, new medications such as a medication that will come without side effects for those with Tourette's more likely to come out, and more effective therapies, because right now the therapies that they have are repetitive, and you need repetitive courses in order to help better control your tics, but better therapies are being developed into where you won't need nearly as much therapy lessons.
There are two symptoms of Tourette syndrome. The first ones are called motor tics and the second ones are called vocal tics. There are two categories to both of these: the complex motor tics and the simple motor tics, and then the complex vocal tics and simple vocal tics. Simple vocal tics are just simple sounds that are made like by a person. They're not like formed words or formed sentences. These are just little sounds that come out of a person's like mouth involuntarily, and obviously can't be handled, but they're just really like small and simple. And complex vocal tics are formed phrases and words, and sometimes can result in them saying curse words, and it's like really effective around any place, any social place that they're around, and can really affect them. Motor tics are just one muscle movements, and complex motor tics involve more than one muscle to function. These complex motor tics can end up in a person being harmed or their lifestyle really affected, and complex motor tics are just tics that happen naturally and are a little bit more not controllable but are easy to handle around.
So there's multiple technologies used in diagnosing Tourette syndrome. Not one involving a blood test per se. There's multiple scans you can take to see if you have that Tourette syndrome or another disorder. You can take an MRI, a CT, or an EEG scan.
The statistics for this disorder is 1 in every 100 kids around schooling age, which is about 3 million people nationwide. Another thing is that 86% of the people diagnosed with Tourette's also suffer from other psychological disorders.
My name's Jordan Ford. I have Tourette syndrome. I've been living with it for about 10 years now. From as I've lived, my symptoms have like changed a little bit. It started off when I first did it was like head jerking, shoulders, arms flying, but then it like slowly reduced itself just over time as faded to more like eye twitching, jaw movement.
Lifestyle with Tourette syndrome can be a bit difficult due to bullying because of severe Tourette's as a young age. Other than that, people with this disorder are still able to do everyday tasks such as work and hobbies. The only difference is that they have tics, which are involuntary movements due to neurological disorders.
Although Tourette syndrome is not cured, there are many treatments such as being active, so doing yoga, avoiding stress, meditation helps a lot with that, not causing a lot of attention, having hobbies, any medications that help block or lessen dopamine such as pimozide or Risperdal, and also therapy such as behavior therapy and psychotherapy, and also any relaxation methods such as breathing techniques, meditation, and yoga.
Mental symptoms. There are a lot of related issues that come with Tourette syndrome. Some of these examples are OCD, ADHD, executive dysfunction, and a lot of processing disorders. Processing issues in Tourette syndrome is just a lot of anxiety for them. They always have difficulties keeping a conversation or remembering a lot of information that is given to them. And it's just like a lot of difficulties in following simple instructions. ADHD and Tourette syndrome have a lot of the same characteristics and are very related to each other. OCD and Tourette syndrome patients include obsessive compulsions that are very similar to tics. These obsessions and compulsions affect the person greatly, but they are not visible to others. They just affect them personally.